subfield of forensic science that focuses on how to think about and do work at the intersection of the criminal justice and mental health systems. Clinical Behavioral Forensic Science, the branch of behavioral forensic science that emphasizes the application of psychological assessment, diagnostics, and treatments to various offender-victim populations and within diverse crime and justice contexts. Forensic Psychology, the academic and educational arena in which behavioral forensic science is learned, practiced. Law, Psychology, Behavioral Forensic Science, the branch of behavioral forensic science that emphasizes the application of evidence-based law and social sciences to various offender-victim population and within diverse crime and justice context. Law, Psychology, Justice, Behavioral Forensic Science, the branch of behavioral forensic science that emphasizes the application of philosophy and ethical principles to various offender-victim population and within diverse crime and justice context. Introduction. The behavioral forensic science field has grown dramatically in the past several decades. The growth represents an effort to meet the increasing demands of the criminal justice system and its police, court, and correctional apparatus and respective workforces. Addressing these often technical, clinically challenging, and policy-oriented demands requires an appreciation for psychological insights and values, an understanding of the behavior, and a grasp of the victim-offender processing, treatment and community re-entry, and understanding of forensics. The academic subfield that typically attends to the issues located at this intersection is forensic psychology. These issues extend to various levels of investigation and include individual, group, institutional, and societal domains of inquiry and analysis. Although forensic psychology emerged in the early 1900s, the American Psychological Association did not formally recognize it as a specialty until 2001. Consequently, the contours of this subfield have yet to be fully agreed upon or even delineated. Some investigators broadly describe it as any application of psychological research methods, theory, and practice to a task faced by the legal system. Despite the absence of consensus on what forensic psychology conceptually means, including the expansiveness of its scope and focus, it has quickly established itself as one of the leading academic sub-disciplines in psychology. In order to prepare researchers and practitioners for careers in forensic psychology, a number of graduate training models have been developed. These instructional frameworks incorporate a diverse range of evidence-based scientific approaches into their service-based and related practices. However, given the burgeoning pace of the field's development, the robustness of each model remains a source of ongoing theoretical and empirical investigation. In what follows, three educational philosophies for thinking about and doing forensic psychology, that is behavioral forensic science, are described. These models include the clinical, the law psychology, and the law psychology justice approaches. Several distinguishing facets of the models are described, including their respective didactic framework, definition of the client-practitioner relationship, preferred method of intervention, understanding of the psychologist-organization relationship. A proposed agenda for future directions concludes the essay, mindful of the three educational philosophies under review. Education and Training in Forensic Psychology. Heading: The clinical approach to thinking about and doing behavioral forensic science. The clinical approach principally addresses criminal and delinquent behavior. Clinical practitioners offer police departments, judicial officials, correctional administrations sound psychotherapeutically based solutions to problems that they frequently encounter within their respective agencies, courtrooms, prisons, and treatment centers. As such, these mental health professionals provide clinically grounded insight regarding adult and juvenile criminal pathology, whatever its manifestations. Specifically, as scientifically trained practitioners, police, criminal, and correctional psychologists meet the system's behavioral forensic science needs through victim and offender evaluation, diagnosis, and treatment. These interventions represent forms of institutional and community assistance. The didactic framework of clinical approach to behavioral forensic science offers graduate students a traditional course of study, resulting in the award of either PhD or a PsyD, that is Practitioner Scholar degree. The PhD curriculum includes a classroom instruction followed by pre-doctoral and often post-doctoral internship. The PsyD curriculum implements elements of the pre-doctoral internship experience into the classroom training and may include a post-doctoral internship. In both instances, students receive instruction on standard cognate areas of study, including testing and assessment, therapy and treatment, research methods and statistics. While the pedagogical strategies leading to each degree are somewhat distinct, both didactic frameworks within the clinical orientation primarily focus on evidence-based coursework and related instructional training. Once these requirements are completed, dissertation supervision, independent research, faculty mentoring, and field placements provide students with real-world experience in forensic psychology. At the core of the clinical approach is the relationship between the offender-client and the practitioner. An effective client-practitioner relationship is imperative to an understanding of the crime and delinquency and psychopathologies that contribute to criminal behavior. From the clinical perspective, the therapist is viewed as a member of the mental health community and is presented to the client or the offender regardless of the degree, type, and frequency of crime. Thus, the offender or a client is perceived as an average citizen who requires assistance from a mental health professional, including various forms of clinical intervention. Typically, such evaluations and treatments are court-ordered, although practitioners may be required to conduct assessments, delineate a diagnosis, and provide therapy. Their essential purpose is to draw attention to the psychological state of the offender or a patient in order to ensure the mental health problems are properly identified and addressed. The clinical approach adopts a similar kind of client-practitioner relationship with the victims of crime whose trauma and recovery issues also necessitate evaluation, diagnostics, and treatment. In order to properly evaluate an individual, the clinical approach to behavioral forensic science includes a broad range of projective, intellectual, and personality assessment tools. Additionally, a host of therapeutic approaches and prevention treatment techniques are employed. Because valid and reliable instruments from all three types of testing are used to reach context-specific mental health determinations, proponents of the clinical orientation contend that its intervention and recommendations amount to scientifically sound behavioral forensic practice. Given that these professionals are principally concerned for the client's mental health and well-being, their relationship with police precincts, court agencies, correctional facilities, and community-based programs is often somewhat detached. Indeed, clinical specialists are commonly perceived as outsiders within the organizations in which they work. As such, in order to best serve the needs of their patients, practitioners schooled in the clinical approach determine intervention strategies that law enforcement officials, judicial administrators, correctional managers, and treatment centers can employ within their own organizations. One example in which clinically trained practitioners are utilized within the system is in the administration of competency evaluations involving the death penalty. As requested by the courts, clinicians seek to determine two critical findings. Does the defendant have the capacity to understand in general the death penalty and its effects should it be imposed, or can the defendant coherently communicate relevant facts and mitigation to his or her attorney? If the offender is found incompetent, the former psychologist will dispense treatment, recommending drug therapy in order to restore one's competency, such that the execution can then proceed. The role of clinician is to conducting competency for execution evaluation continues to be fiercely debated among those within and outside of the behavioral forensic science field. Next heading, the law psychology approach to thinking about and doing behavioral forensic science. Another educational model within the realm of behavioral forensic science is the law psychology approach. While its clinical counterpart rigorously emphasizes empirically based inquiry and solutions, this didactic strategy additionally incorporates the study of law and legal decision making into its understanding of forensic psychology. In other words, beyond scientifically examining individual behavior, the pedagogical aim is to produce legally informed clinicians. Consequently, students are cross-trained in the two distinct disciplines. The overall instruction is designed primarily for professionals pursuing careers in research, policy, and consultation. In order to prepare students for careers in law and psychology, the model's educational strategy requires instruction that results in the conferral of JD degree or a PhD or a PsyD degree in clinical psychology. Although the purpose of the curriculum is twofold, the coursework in these two disciplinary specific areas are typically offered with a little regard for any meaningful integration of both academic domains. That is, law and psychology curricular courses only occasionally address topics in which the interdependence of the two fields is featured, such as law and behavioral science. Much like the clinical model, law and psychology didactic framework is designed to include both in-class training and internship experience. Additionally, pre-doctoral practicum training is required. The law psychology approach is also similar to the clinical counterpart in that both ultimately seek to examine and or treat the offender or patient individual behavior, emphasizing ownership and responsibility for criminal wrongdoing. Advocates of this perspective assert that society's greater interests are promoted when aberrant conduct is addressed and remedied. The law psychology approach traditionally defines the client-practitioner relationship as one in which the patient's mental health needs warrant attention and the behavioral forensic expert intervenes as this professional would for any other individual seeking assistance. However, the law psychology model is distinct in several important aspects. Fundamentally, it establishes the legally informed clinician whose instruction or training in testing, diagnostics, therapy, and related scientific practices enables the specialist to identify empirically sourced and quote relevant treatment strategies. These interventions therapeutically address the patient's psychiatric condition, but within the limits of what the law will allow. Second, it creates a lawyer psychologist whose instruction, training in dispute resolution, law and social science, therapeutic jurisprudence, and related skills-based practices readies this professional to assess the effectiveness of any clinical psychological intervention, mindful of the various civil, criminal, justice, milieux, and context for adjudication. Third, in addition to the considerable grounding in forensic mental health, lawyer psychologists receive detailed exposure to legal reasoning, writing, decision making, as well as professional trial practice experience. The interventions that follow from this dual preparation intend to yield better case-oriented and solution-focused outcomes for patients, whether as perpetrators or victims of crime. The relationship between legally trained clinicians and the agencies, courts, and other facilities that solicit consultation from or otherwise employ them is somewhat attenuated. Much like the training of clinicians, lawyer psychologists often are perceived as outsiders. Indeed, while they understand the dynamics associated with the legal and psychological systems more broadly and synthetically than traditionally trained clinicians, whose focus mostly, especially on the individual patient difficulties, nonetheless emerge for law psychology specialists. These difficulties relate to developing or implementing institutional interventions, mindful of organizational cultural influences that regularly impose bureaucratic barriers. These barriers can and often do undermine prospects for growth and change. In practice, professionals informed by law psychology model may fill several roles within the criminal justice system. Legally informed clinical researchers often undertake an examination of the practical issues. One example is the eyewitness testimony. Its more complete investigation involves a comprehension of both cognitive and legal intricacies. These experts may be called upon by prosecuting or defense attorneys to serve as forensic behavioral witnesses. When brought before a court, a specialist typically discusses the empirical evidence related to eyewitness testimony. But this testimony also includes its shortcomings, especially when used for the purposes of courtroom decision making regarding various civil and criminal claims and/or disputes. These forensically sourced observations assist jury members and jurists as they assess the credibility or even admissibility of such expert accounts. Thus, legally informed researchers and clinicians provide useful information on scientific matters at the law psychology nexus. The law psychology justice approach to thinking about and doing behavioral forensic science. Unlike the clinical and law psychology approaches, the law psychology justice model is multidisciplinary in orientation. Its psychosocial lens is more broadly focused at its assessment of those dynamics that influence or co-produce the phenomena investigated within the expansive frame ambit. As a practical matter, the framework addresses individual, group, collectivist, and societal behavior, including its civil forms, especially institutional levels of analysis, and criminal dimensions, consisting of individual responsibility and organizational accountability. Committed to citizen justice, communal well-being, and large-scale reform, those educated in this approach promote individual growth and social change through the theory and practice of psychological jurisprudence. PI refers to theories that depict, account for, and predict law by examining human behavior. Thus, rather than studying how judges and other legal agents within the mental health and justice system make decisions, PJ informs judicial officers, legislators, and administrators on how they could and should make decisions, especially when guided by the PJ's method of critique. The law psychology justice approach is structured such that students eventually attain the PhD degree. Educational philosophy is distinct from its clinical as well as law psychology counterparts in that it relies heavily on integrative and cross-disciplinary pedagogy. Thus, in addition to the standard coursework in behavioral forensic sciences, as developed by its competing models, the law psychology justice orientation exposes students to subject matter in sociology, organizational science, philosophy, cultural studies, and political social theory, as well as integrative curricular offerings in psychology and law. Exposure to the overall instructional framework allows students to more completely examine and/or critique how values such as dignity, fairness, autonomy, agency, community, freedom, ethics, and the like function or not within the systems of risk management and social control. Example: penal, psychiatric, social welfare, and legal apparatuses. Students earning the PhD degree typically pursue positions in mental health and justice administration, community organizations and leadership, human services and social welfare management, political and social activism, law and public policy, or academic research. In preparation for a career in these fields, postdoctoral practicum experiences are developed that bolster didactic instruction as an element of educational praxis, that is, thinking about and acting on human and social justice and change. These enrichment activities help to ready graduates for the complex work demands situated within the behavioral forensic science field. Those trained according to the law, psychology, justice model posit that each of us, that is, kept or as their keepers, managers, and watchers, cannot exist apart from the structural and institutional forces or intensities to which we are connected. In other words, captivity and risk management affects all of our lives to varying degrees. Accordingly, professionals schooled by way of this framework seek to normatively identify and dynamically overcome the underlying conditions that nurture and sustain such madness for one and all. In this regard, the law, psychology, justice approach challenges extant notions of duty, responsibility, consequence, interest, violence, compassion, health, recovery, and the like. Moreover, its reformist agenda endeavors to discern how justice is defined and for whom it is served, given the circumscribed and often carnival-like policies and practices emanating from the mental health, social welfare, and criminal justice systems. As a diagnosis of madness understood as systematic pathology, this critical discernment identifies the co-productive symbolic, linguistic, material, and cultural forces, that is, symptoms, that support harmful conditions of reality. These socially constructed fictions often and unwittingly set limits to being the recovering subject and impose denials on becoming the transforming subject. This is harm that interdependently affects us all. The recognition of the shared injury, struggle, and even deception enables the law, psychology, justice professional to cultivate a client-practitioner relationship marked by the considerable inclusiveness and transparency. To be clear, practitioner may represent the interest of individuals as well as those agencies and institutions that employ them, and the greater society to which they all are inexorably bound. As such, the behavioral forensic expert connection to and the relationship with whose suffering from the violence of captivity and risk management are both fluid in nature and emergent in intervention. The intervention methods employed by the law, psychology, justice specialists are directly linked to the PJ theory and its ethically sourced core practices. These practices consist of common sense justice, advancing dignity and fair-mindedness, therapeutic justice, jurisprudence, using law as a healing agent, and restorative justice, that is, making peace among those who offend, those victimized, and the communities that unite them. The integration of these practices grow habits of character and of caring that, when genuinely embodied and regularly examined, instantiate self-excellence or human flourishing. When exercised dynamically as virtues or living justly, benevolently, wisely, generously, the synthetic practices of PJ more humanely and communally treat the distress of the kept, those confined, and their keepers, those who confine, and their managers, those who administer confinement, and their watchers, that is, politicians, pundits, and public at large. This is a clinical sociological method for overcoming the harm of captivity, risk, and character's devolution. This includes injury regardless of its civil forms. Example, courts waiving developmentally immature juveniles to adult system found competent for trial, prisons placing psychiatrically disordered offenders in prolonged disciplinary segregation, not considered cruel and unusual punishment, or criminal dimensions, seeking limits to the being and imposing denials and becoming for one and all. Future directions, the clinical approach. In addition to broadening coursework and training options, some leaders in the field have recommended that clinical curricula focused on cognitive, developmental, experimental, social psychology should be available so that more students can then cultivate an expertise in one of these practice domains. Drawing upon a sound body of research revealing correlations between biological factors and antisocial conduct, forensic neuropsychology seeks to apply the science of brain-behavior relationship to legal decision making and courtroom practice. In order to better meet the increasing demand for these practitioners, traditional clinical curricula should be expanded to include optional instruction in theory and methodology of this emerging and promising area. Moreover, critics within the forensic psychology field assert that by narrowly concentrating on evaluation, diagnosis, and treatment of individual clients, non-clinical problems contributing to deviancy and delinquency are potentially overlooked by the practitioners. Thus, the clinical didactic framework additionally would benefit from coursework and the practice opportunities that invited students to examine how economic, environmental, social, systemic factors contribute to a more complete understanding of offender behavior, violence and victimization, and effective programmatic responses to both. The law psychology approach, second heading. As described previously, law psychology didactic framework does not include systematically integrated training in these two disciplines. Thus, the coursework that squarely addresses established or emerging issues at the nexus of law and psychology should be developed. Although legally informed clinicians may perceive themselves as insiders who provide judicial, officials, correctional, administrators, and other institutional decision makers with relevant empirical evidence, those of this model efficacy argue that the adherents of recognize the importance of social problems persist because conflicting group values and competing political intents are not because authorities lack accurate information. But keep this in mind, course offerings, field training and education consistent with PG is proposed as relevant for practical exploration of these forensic behavioral professionals. This instruction would focus on PG's core principles, that is common sense, justice, therapeutic, jurisprudence and restorative justice, and their corresponding principles. The law psychology justice approach. The future directions of law psychology justice includes the expansion of the integrative coursework and continuing education, changes in academic inquiry and research methodology, experimental field training and practicum, placements in novel programming in human service and social policy and practice. These collective reforms would be from the ethics-based philosophy of PJ, thus probing intersections and synthesis of common sense justice, therapeutic jurisprudence and restorative justice is foundational, maximizing each undertaking's potential. Curricular and related educational offerings in forensic psychology, law, human behavior, humanitarian and juvenile and family law, criminal psychology await development. In each course, concerns for re-diagnosing madness, advancing citizenship and revisiting social justice would inform the pedagogy. A research enterprise that studies forces of captivity and risk management also is needed. Investigatory focus would examine where and how habitual character, that is virtues, inform all facets of behavior science decision making. Where human flourishing for about all is limited or denied, research strategies for overcoming this harm by way of assessment instruments, psychotherapy intervention and institutional programming would be established. The relevance of these scientific findings and the reformative critique in which they are based would be community-based treatments. The praxis of these new initiatives would emphasize the mutuality of human agency, infrastructure, insight and change. This solution focused ultimately benefiting the kept and their keepers, managers and their watchers. The solution would be the conditions of control, interdependency, intensifies co-produce human agency, social structural injury. The constitutive forces of this woundedness render our imaginary text embodies practices and cultural representations of offenders and victims, violence and victimization, treatment and recovery, health and restoration, etc. Incomplete or more than what they could be and could become. Community-based praxis, the law psychology justice model, endeavors to overcome this harm through exercise of dynamic and transformative character building habits.